Hello, hello. Hi, everyone. Hi, everyone. Happy Wednesday. From Toronto, Dr. Amin here. Good to see you all. Thumbs up if you can hear me and if you have my voice. Topic today. Yes, of course. Someone's asking what's the topic today. We're going live with Dr. Catherine Johnson, and we want to talk about longevity, how to stay happy, healthy, and have a great life, long life. So that's the great. Thanks, Odian. So we want to talk all about prevention and how to stay healthy and forever young. I was just kidding. If you have any questions, do not hesitate to drop it in the comment or the question bubble. And we try to go through those questions. And yes, I can see Catherine's here. I'm going to Dr. Johnson. Hello.
Hello. So I'm glad to meet you in Miami. It was so
I
beautiful.
know.
And
Lovely to have you here today.
thank you. It's so good to see you. We connected right away at the conference. This was Dr. Jiva's conference in Miami, and Pau heard. And, we learned so much there. We connected with so many women who are seeking healthy longevity. And we each learned from one another just how our practices can align to offer insights and information for women who are trying to understand what is healthy longevity, how do hormones come into the play. And at the conference, Dr. Jule brought in speakers who spoke to our metabolism. Dr. Rocio spoke about the GLPs. We had speakers speak about journaling, about menopause in the workplace, about the importance of community, about the importance of really understanding how sexual health is part of your health, also mental health. I have a book that I ordered, High Functioning from Dr. Judith. And so I just love going to conferences. This is kicking off the Longevity Healthy Conference season. So, and I get to meet awesome physicians all over the country and world. Just like you're in Canada, I'm here in the Chicago suburbs. I started my practice looking for ways I could improve my own health. And I wasn't feeling well. I wasn't feeling like myself. And I meet women every day who, and men, their husbands come, their sons, their family members. And, you're seeing your regular doctors, and you, as a physician, in the conventional system, we can only do so much. We only have so much time. But when we go beyond and when we study more and when we take the time to order a few more tests, spend a little more time with our patients, we can really help them see how are they aging and then what can we do about it? Because can you truly age later? And I would say yes, you can. But first we have to understand how you're aging individually.
Great. Lovely start. I love that. It's great. I mean, I always say, especially in today's world, us doctors, conventionally, traditionally trained doctors, we are great, exceptionally skilled to treat acute symptoms and save lives in ER and mastered in reactive medicine. But the question is this enough? In this today's life that we have chronic disease on rise, neurodegenerative disease, metabolic disease. So how can we prevent? I think this is where preventive medicine, the conversation around preventive medicine and longevity starts. What are your thoughts on this?
Agree completely. And I think it's the nuance of what is normal versus optimal. And for each person that we're treating, what is optimal for them at what stage of their life, right? And so this is the precision assessment of one's health. We use laboratory data, we use body composition data. I'm at my office here, and we have the scale where you get on the scale and it shows you how many pounds of fat you have, how many pounds of muscle you have. Where is your fat? Is it subcutaneous, which gives us our glow, or is it visceral fat? Is it around
Mm,
the organs like the liver and the heart? And is it metabolically causing this inflammation? What are the blood sugars? What is the insulin level, the cortisol level? What is happening with your sex hormones, testosterone, estrogen, progesterone, FSH, LH? Thyroid. We love to see the nutrient markers, vitamin D, zinc, B12, folate. We like to see the metabolic markers, homocysteine, uric acid, the
mhm,
fasting lipid panel, the triglycerides, and also the advanced lipid markers, the apoprotein B, the lipoprotein little a, and one of my favorite biomarkers is the omega levels. And that is
mhm,
really speaking to an integrative assessment of each person. So our healthcare system tends to be very fragmented, where you're seeing different specialists who are, telling you just about the domain of health that they are experts in. And you and I, we're interested in seeing the whole person and helping them get away from this fragmented system and think about, okay, how am I really feeling today? What does the data show me? And can you give me a plan? And how can we track it and trend it and make sure that the interventions that we're implementing are actually having effect instead of following a fad that may not be personalized to our unique needs at the time?
exactly. To be holistic, I think that's what people looking for, to come to have a life coach and the guidance and plan. So that's very important.
It's true. When people say, well, what exactly is precision medicine? For some
Mhm,
people, I am their life coach, their health coach. I'm their friend. I'm their translator. I'm their interpreter. For other people, we really go deep into metabolism. We're using supplements, medications, we're using wearables, and I'm directing them to advanced tests and specialists who can help them navigate. What we're finding, because it can be overwhelming sometimes to get all this data. It can be a big investment in what people are paying for their health. And I think they really want a partner and someone who says, okay, we've been practicing medicine for some time. I don't think this is the kind of medicine you can just come right out of training and start doing. I think you really have to appreciate and live for yourself. We're mothers, we're wives, we live within our communities. So
mhm,
we've experienced things as parents, as children of parents who are aging, and also seeing people day after day confronting difficult diagnoses, cancer, dementia, and thinking to ourselves, okay, we know about cardiovascular risk, we hear about hormones, we hear about diet, nutrition, sleep, but how does it really work for what I'm going through today?
absolutely. Especially for women, I think it's very important. Again, we see a movement for women's health now. Everyone's focused talking about hormones, how important these hormones are in our lives, these changes during puberty, pregnancy, and then later in life in menopause, and how it can affect the whole system, our whole body. So, I mean, I love women's health. My focus on women's health, but uh, how do you deal with that, and what is your recommendation when you see women going through the change and transition?
Yes, and to be clear, for women, it can come at any age. Some women are experiencing some penetrance of the perimenopausal syndromes just during their PMS, and they're starting to really have difficulty sleeping, concentrating, brain fog, joint pain, and it's just a few days out of the month. And then as they get closer to 40 and in the 50s, it starts to become pretty significant, where maybe 2 weeks out of the month, they are not themselves. They feel really tired. They feel depleted. They're not interested in sex, lose
Mhm.
interest in meeting friends. I you know, myself, like when I stopped shopping and being interested in fashion and decorating and, you know, all the things, I was like, what happened to me? Where am I? Who am I? And my family, my husband, my children, same thing. Where is she? Is she in there?
Mhm.
Hello. And so whenever this happens to women, you know, to realize you're not alone. And then I like to show them the labs. I know a lot of doctors will say, we don't have to check hormone levels. Well, I like to show women here are your hormones on these days of your cycle, and then we can trend them over different days, and you can see how volatile this is, right? And how
Mhm.
you can really feel differently from one week to another. Men don't experience this, women do. And some of us, maybe 20% of us, it can be so impactful that it's causing changes in our relationships, our professional career trajectories, and that really creates an opportunity where we can offer support, education, guidance, and also treatment that is life
Mhm.
changing.
Absolutely great. So, so once these people, women start feeling those symptoms or notice these symptoms, or someone told them what, so to see us and have some tests, but how can these people be more proactive with lifestyle? I mean, there are so many things that little things and steps we can take to help ourselves. Would you recommend those to your patients? Some
Yes, I mean,
changes?
usually the first question I ask is, do you wake up to an alarm in the morning or do you wake up naturally? So this is my biomarker of sleep adequacy. So if you're
Mhm.
waking up to an alarm to go exercise, even though your body's telling you to sleep, to protect your peace, protect your rest, I recommend protect your sleep, right? Because it becomes so fragmented, so challenged by raising our children, being stressed, having the hormonal fluctuations. So the hurried woman syndrome is the woman I tend to see. She is so busy, busy, busy. She just goes and goes and goes and believes that if she just diets more aggressively, works out a little harder, it will come together, you know. And often what that does is just it backfires for her, and she's not resting, she's not protecting her peace, she's not taking the time to manage her commotion and to prioritize in her life what is fundamental to health optimization, which is of course the sleep adequacy. So that's number one. It's difficult to do as working women and mothers and parents and spouses. Our husbands need a lot of attention. Our practices and our offices need a lot of attention. So you can feel very depleted. And then when we do the labs, and I can say, well, you have iron deficiency or you have, you know, hormone depletion, then it offers a patient and a woman the opportunity to say, oh, I have a reason. So let's treat it and let's assess and see, is it helping to treat it? And then that creates validation and reassurance that it's not a shortcoming she has, and it's actually something that makes sense. And the more we can make it make sense, the more we can actually see women go from thinking, oh, they're not eating the right diets, to wow, what if we
Mhm.
supplement you strategically? What if we treat the metabolic dysfunction, the hormone dysregulation, and then you can actually start feeling like yourself again?
Mhm. Yes, it takes some time,
It
but
does.
if one starts working together with the physician, I think it gradually everything, these little pieces of jigsaw will fall in place and they feel gradual better and improvement in their health.
That's the hope. And I always tell my patients too, if something's not working, I want to know. I mean, I
Mhm.
love hearing that everything's going well and you feel better, but especially when you don't feel well, I want to research a little bit more what's happening so we can identify what is the trigger. And that's really how we see how women age differently, right? Some it's the hormones, some it's the lifestyle, the diet. Others it's really an intrinsic autoinflammatory syndrome. And sometimes that can be our own stress levels. High achieving women tend to have different levels of stress hormone production that can be very good for them when they're young, but can really
Yes.
burn you out and leave you wired and tired later in life. And then you're just so depleted. So I say we're going to try to fluff you up to get you feeling vital again. And then there's just different stages to optimization. We have foundational optimization, and then we get into some of the more, once everything metabolically is healthier, your body composition is stronger, then how can we use some of these longevity tools to really go next level and be very preventive? And that's where we're thinking, okay, if we can treat sooner, will we see and identify women who have healthier brains, less heart disease, more function, mobility, executive functioning, strength? Because really, we know the older we get, the stronger we are, the more resilient we are. And I want every woman to know, you don't ever have to do your 20s, 30s, and 40s ever again. The beauty of getting older is all those years where you work so hard to do all the things. You don't have to do those again. You have achieved so much. And now how do you step into a place of life where you've done the achievement? Now, how do you regulate and really prosper and create that vitality and create legacy for your community? And that's the fun part, is how we inspire our daughters, our friends, our sisters, our community to really step into better health.
Exactly. To age gracefully and powerfully. Yes, to be highest time, so and achieve more when we're hopefully healthy. That's very important. I see more and more patients who middle age come and see me complaining about, as you mentioned, feeling tired and fatigued, not able to sleep, weight gain, and just they're not themselves. So, and this is we see more and more. And then in practice, we see, although still hormones are not approved to be used perimenopause, before menopause, but we see more and more usage of these hormones as a prevention of so many diseases, with more studies like Dr. Mosconi's book and study about brain, how important hormone is in brain health. What are your thoughts about having hormones before menopause, or do you prescribe them?
Absolutely. Absolutely. And I think this is the nuance. And remember, most women are receiving hormone therapy in the premenopausal transition. It's their birth control pill, right? And usually the birth control pill is prescribed to basically mute the symptoms of hormonal volatility. If it's your acne, if it's your dysregulated menstrual bleeding, if it's your heavy periods, if it's the mood issues, if it's for contraception, which is, of course, so important, right? So how we can creatively assess and determine really what the birth control pill can do for many women is liberate them from worrying about getting pregnant at the wrong time. That's very important. But also for some women, it's really binding up their testosterone levels. And testosterone for women is so important for their vitality, for their executive functioning, for their memory, for their willingness and interest in going out to go harder, to achieve more. And that's something I think a lot of people don't know, especially when we see the skinny fat. And there are so many women who they're working out really hard, they're prioritizing their protein, but when the hormones aren't right, you're more likely to just get injured at the gym and get excess stored energy as opposed to really building muscle, bone, brain. And so hormones, it really takes some nuance. And that's something I suffered with: endometriosis, adenomyosis. I needed a hysterectomy. Having lived through it, it really helped me understand that too much can be inflammatory, too little can be so empty and so tragic. So finding every woman's, you know, spot where she's well and listening to women, because every woman's different. We have so many different, men, testosterone is a cream, a gel, or a shot. Basically, for women, we have a spray, we have a cream, we have a patch, we have a gel, we have a pill, we have so many formulations, and they feel differently for each woman at different times of their life. And so I
Exactly.
think,
I
yeah.
mean, that's where I think personalized and precision medicine comes in. It's very important to be personalized, and each person is different. So to assess, as you mentioned, is so important to do those functional biomarkers checks is very important, and then come up with this management plan. And what about diet? Any do you recommend your patients any specific diet?
Well,
Any
we
changes?
definitely use a precision approach to diet. So I
Mhm.
think, if there's iron deficiency, we'll be recommending certain foods that can optimize the iron absorption. When we see the guts issues where you're not absorbing very well, maybe it's because of stress, then we need to supplement strategically while we start to help improve the gut health so that you're absorbing nutrients from your food. Um, so in general, I think most Americans, I'm not sure about Canada, but in America, most people are not eating enough fiber. So really prioritizing the fiber is really helpful, prioritizing protein, and then really paying attention. I'm a believer in the elimination diet. So really minimizing the flour, the sugar, the dairy, and then reintroducing those to see what makes you flare a little bit. And flare can be skin changes, it can be fluid retention, it can be brain fog, joint issues, and that can help you become the more quantified self and personalize your nutrition. But in general, minimizing processed foods is number one, right? So if there's a label, I would say, well, why aren't we just eating more chicken, eggs, salmon, fish, greens, veggies, apples, pears, all of the foods that just come from nature.
Okay.
And many times, too, if you're storing extra energy, to remind yourself you don't have to eat, you're choosing to eat, really. So this is why the body composition data is so helpful, is telling yourself, can you become metabolically adapted and flexible so that if there isn't something good to eat, how you can train your body to use your stored energy in the absence of healthier nutrients. And then when it's time to eat, you're nourishing your body well. So it's good to be a little hungry, and it's also good to be well nourished. So finding the right balance for each person is something we try to do in practice. And so we create feeding windows and fasting windows for each patient, depending on, are we trying to get them leaner? Are we trying to get them stronger? What their goals are. And biologically, we're different from month to month, year to year, and so should our diet be, so should the recommendations be, and we should correlate that with data to help inform what is the best diet for each person.
Even day to day, we're different in a
Yeah.
cycle, isn't it? Whilst we're
Well, I
cycling with
remember.
funds, yes.
Yeah, I do think in the future, hopefully while we're still living, and this is really our pursuit, is to appreciate our lifespan so we can see the advances that are coming in medicine. So maybe one day we'll flush our toilet and there'll be some genetic sequencing of what's in the stool content to say you should be eating this, not that, right? And right now, you can do these stool tests and stuff, but it's weeks of delay, and really our gut health is changing from meal to meal. So I'm a big believer that if it's not healthy for you, if it's not going to add nourishment to your body, I'd rather you wait, stay hydrated, and then choose to nourish yourself with the right macronutrients.
Yeah, that's great. That's very good recommendation. Something that I think a lot of times forget is about detoxification. So that is so important too. It's very important, plays an important role in our health to don't forget about detox organs. Starts from skin, going down to our gut, liver. So it's so important, even good.
Kidneys and lungs, right? Yeah. And I
Yes,
think this is something we have
exactly.
detox organs, right? So just as I said, I'm asking every patient, how are you waking up in the mornings? Also, how are you eliminating? Do you sweat? Do you poop every day? How often are you eliminating urine from the bladder? How adequate are these pathways? Because really, that is, I think, very often missed. And that is that if we're going to give hormones, they could actually cause harm if I want you to use it and lose it, right? So efficiently metabolize it so we don't see these metabolites that can cause harm.
Exactly. What about screening tests? What are your thoughts on screening tests, and do you do that for the patients or arrange that?
Absolutely. So our initial intake is screening for the lipid issues, the genetic issues. And then after we do the foundational work, we offer advanced testing. So I like to see DEXA scans, the bone density before the fifth decade. I like to see coronary calcium data. I also will offer, we have liquid biopsy testing. This is also related to one's budget, right? Because
Exactly.
there is nuance to how we can interpret the test.
Yes.
And also the most cost efficient way to manage a patient is to listen very carefully. If you have a woman who's constantly bloated, always has fluid retention, I'm thinking, why? I want to see a scan of her ovaries. I want to see the liver. I want to better understand. So ordering diagnostic testing with a very astute historical perspective of the patient and really getting back to taking a good history is so important. I think lost in this quick
Very
medicine. Yeah.
exactly.
And we have very cool tests. I've done the pre-nuvo, the MRI testing. I've done all sorts of advanced testing, but I come back to the foundational tests and trending them over time because I do
Mhm.
think that's where you learn the most about health.
Yeah, someone is asking about supplements. What supplements are at the top of your list?
Yes. And
Mhm.
I do. I love supplements and I love precision supplementation. So usually foundational supplements will include omega 3s. So that's going to be your EPA, your DHA, your DPA. And so you want to get a high quality fish oil supplement. Most people have omega deficiency unless you're eating sardines and flaxseed and salmon every day with your olive oil. We don't see that very often in the
No.
standard American diet. Secondly, vitamin D is a common uh, supplemental challenge, as is B12. And for women in the perimenopausal space and also with pregnancy, folate is so important. So we look closely at the B vitamins. I see quite a bit of zinc deficiency. So those tend to be the staples, is a good omega, a good vitamin D, and then the B vitamins. And then we'll supplement strategically based on what people are missing and supporting if it's with prebiotics, which are your fiber supplements, probiotics, which I like spores quite a bit, the bacillus species. And so we're going to be using supplements that are high quality, that we're actually trending data over time to show that there's clinical utility, because otherwise you may just be wasting a lot of money. But we do use more creatine lately, for especially bone health. Magnesium, I think, is really a common depletion as well, and so important as well. So most of my patients are taking those supplements, and we're checking trending and supplementing for each person.
And any thoughts about, again, many people question about GLP-1s, these medications,
Yes.
peptides for weight management, weight loss, diabetes, or
Mhm.
metabolic disease management. Any
So
thoughts
I'm
on that?
very aggressive. I'm very aggressive. I think the glucagon-like peptides. So we have semaglutide, which is Ozempic or Wegovy. We also have tirzepatide, which is Mounjaro, which is also Zepbound. These are
Mhm.
very potent metabolic uh, molecules that can give advantage to one. So if you have prediabetes, a fasting blood sugar greater than 100, and you have more than 7 to 10% of excess weight to lose of your total body weight, the American Academy of Clinical Endocrinology in 2023 said first line drug is GLP. Right? I don't see that in practice. Many insurance companies don't practice that. We also see in women, especially petite women, the BMI is low, but the weights, even if it's 5 or 10 pounds, is all that squishy, inflammatory excess weight. And
Visceral
treating
fat.
that is so fundamental. And then we also have ancestry. So if there's Southeast, Middle East, South Asian profile, we know the BMI metric is already outdated. In fact, in our FDA in the United States, they don't use BMI anymore in recommendations. It's percentage body fat, waist to hip ratio, And this is so important because muscle weighs more than fat. So you can be well developed, well nourished, very fit, very strong, and actually weigh more than when you're squishy and have just excess fluid retention and inflammatory visceral fat. So that's why I like the data, because then I can show people, listen, those 5, 10 pounds, they're in the wrong place.
Mm-hmm.
And the the challenge of calorie restriction with perimenopause is significant, meaning that your hormones are defeating your basal metabolic rate. And that means most women who are like 5 feet, 5'5", their basal metabolic rate is 1,100 to maybe 1,400 calories a day. That's not much. And then we know with the hormonal changes, we're losing another 20 to 30% of basal metabolic rate. So to get the body into fat burning, we really have to achieve a calorie deficit and still focus on the protein and the fiber. So using these metabolic adjuncts of GLP is something we do a lot in practice.
Mm-hmm.
And we use the lowest dose that we can to get the best results. And we also are very careful about how we manage side effects. We don't want to cause any harm. And some people have significant side effects, and I think too how you source them is very important. We have samples, we teach in the office. I've got lots of samples here in the fridge full of samples. So then I can show patients how to manage and how to trend, and then we're looking at their lean mass, their fat mass, and trending them over time, so they can really see the metabolic impact of using these therapies.
Absolutely. I think this is very important for viewers and whoever who is watching this later. Make sure to start these medications. They're great, as Dr. Johnson mentioned. It's just make sure to do it with a physician together with your health provider and under care rather than doing it yourself. That is no. But don't practice.
Well, and in the United States too, I often see people who ordered their own online or something, and they never had a baseline set of labs. And the
Yeah.
baseline set of labs might have qualified them for getting prescription coverage,
Mhm.
right? So that
Exactly.
to me is a big tragedy, is like you
Yes.
benefit from the medication, yet now you're going to be paying out of pocket because we
Mhm.
don't have the baseline data. And so I think making that investment in getting the data, really having yourself assessed. And we also have a shortage of well qualified people. We have significant wait lists to see specialists, wait time. So I understand the
Yeah,
frustration. I used to be 60 pounds heavier myself. So I get it. Weight loss is hard enough, but maintaining weight loss is even harder. So
absolutely.
it's
That's
real.
true. And one last question about physical activity. Normally, for especially women going through the change and hormonal imbalances, what is the best type of workout or physical activity?
Really, bodies in motion, stay in motion. So I encourage people, do squats between calls. If you can, get a stand-up desk. In my office, I have the power plate. I've got my red light. I've got my dumbbells. We've got a hand
Mhm.
grip assessor. We're really trying to say, okay,
That's
do as
great.
much as you can, even if when you listen, you burn more calories just sitting up straight, right? When I'm
Mhm.
talking to you now, I can be doing little kegels and squeezes of my glutes and keeping my quads fired up. And that's really these non-exercise activities of thermogenesis. The NEAT exploit them. So
Mhm.
fidgeters, people just move. And when we are running our kids around, doing the laundry, cleaning out the garage, that all counts for exercise. So this idea that you're going to go work out for an hour, sweat, and then sit for the rest of your day is a
Mhm.
disaster. So keep your body in motion, keep yourself engaged, and have fun with it and change it up.
Yes.
And
Yes.
don't set your alarm to go to a workout. I'd rather you sleep and then go work out when you feel like you've been adequately rested. And then you'll have a better gains, because your body, when cortisol is high, you can't make muscle. It's impossible.
Exactly. Just stay active,
Mhm.
move. That movement is great for your brain, for the whole body, your joints and bones. I go out running with my dog. It just
Nice.
feels fun. It's great playing with the dog and just do something every day. As you
And
said,
what we're
not to.
doing right now is so good for our health. We're talking,
Mhm.
we're connecting, and
Exactly.
community is so important. Touch animals, our kids. And I think that's so key is finding ways that you can see your friends and it's not for a drink, because alcohol really sabotages so much
Mhm.
of our health. But if we say, let's go for a quick walk or, let's just do a quick sprint or have a plank off, silly things like that.
Yeah,
You see women wearing these weighted vests, this or that. Do whatever you can and
exactly. Someone is
be kind to
asking
yourself.
about melatonin. Do you advise you take melatonin tablets for sleep?
Great question. Melatonin is naturally secreted by the pineal gland, and like many hormones, it can be dysregulated. So we actually start secreting melatonin at around 7 p.m., and we secrete it like we do most hormones in a physiologic, pulsatile manner, meaning that you're making melatonin throughout the whole night into the morning. So if you're going to use a melatonin, I recommend a controlled release formulation. Start with the lowest dose. And remember, anything in the beginning when you're sleep deprived that helps you sleep, you might find the next morning you're so tired and you're never going to take that again. Or you started dreaming and the dreams were scary. That actually means it's working. So I would lean into it, take it a little earlier the next night, and protect your sleep. I love sleeping. I actually say that every night when I go to bed. I love sleeping. I put on my sleep mask, I have my sleep hygiene. If it's melatonin, magnesium, progesterone, valerian, whatever works for you, do it and protect it.
It was lovely. Great talk. I
You too.
loved
So good
it.
to meet you and see you. And I
Yes,
look forward to all the conferences
I
coming up.
know. We
Yeah, we
should
have a
meet
lot
up
coming.
again.
Oh, we will. Absolutely. And you will be, starting your concierge longevity practice. I can't wait to
Yes,
hear the results.
yes,
We can talk some
yes,
cases.
exactly.
And just let people know, invest in yourself, find people that you trust. We're out there. We did it for our own health. We're going to keep doing it. We're going to keep talking about it. And there are more
Yes,
unicorns like us out there. So find us.
definitely. Yes. Great talking to you
You
and
too.
see you soon. And
Okay.
for the viewers, we will post this and so you can view it again if listen or watch it.
Fantastic. Bye.
Great to see you. Take care. Bye
You too.
bye.
Bye.